For many owners, the first sign of a problem is the sound of a dog aggressively scratching in the middle of the night. This repetitive behavior disrupts the household and indicates significant physical distress. Most owners visit the clinic looking for a straightforward, immediate solution to stop the discomfort. Clinically, itching is a symptom of an underlying inflammatory response. It is not a final medical diagnosis, but an indicator of a more complex disease process. Effectively addressing the behavior requires identifying the specific trigger. These causes typically fall into three primary categories: environmental proteins, food hypersensitivities, or reactions to flea saliva. Treating the surface irritation provides only temporary relief. Without a diagnostic plan to isolate the root trigger, the inflammatory cycle will eventually restart. Recurring ear infections are frequently the primary clinical manifestation of a systemic allergy. An underlying allergy alters the sting barrier within the ear canal. This increases inflammation and shifts the delicate microenvironment required for healthy skin. This shift allows native yeast and bacteria to rapidly overgrow across the compromised skin surface. While the infection causes the immediate pain, it is a secondary effect of the original allergy. When infections return shortly after treatment, they indicate that the larger systemic allergy remains unmanaged. Environmental allergies, or atopy, are triggered by common substances such as pollens, grasses, molds, and dust mites. Unlike the respiratory reactions typically seen in humans, dogs absorb these allergens directly through their skin. This results in irritation concentrated on the paws, face, and belly. Atopy often progresses from a mild seasonal annoyance to a severe year-round condition as the immune system becomes increasingly reactive. These environmental triggers are unavoidable. The medical strategy relies on long-term management rather than complete avoidance. Owners often assume a dog cannot be allergic to a food they have eaten for years. In reality, long-term exposure is exactly how food allergies develop. The immune system gradually becomes sensitized to a familiar protein over months or years of repeated consumption. Clinical data identifies specific proteins as the most frequent triggers. As this list shows, beef, chicken, and dairy are common offenders, while grain allergies are relatively rare. Many owners attempt to find quick answers through mail-in saliva or hair tests purchased online. These tests are inaccurate for diagnosing food allergies in dogs. They frequently produce false positives and are not supported by the veterinary dermatology community. Relying on these unreliable diagnostics often increases the total duration of the dog's discomfort by delaying effective medical intervention. The elimination diet trial is the only scientifically reliable method for identifying a food trigger. This diagnostic process requires feeding a specialized prescription hydrolyzed or novel protein diet exclusively for 8 to 12 weeks. Success depends on absolute consistency. A single table scrap or flavored medication can re-trigger the immune response and invalidate 2 months of diagnostic evidence. For complex cases, a board-certified veterinary dermatologist can perform intradermal skin testing to identify specific environmental allergens for immunotherapy. Identifying the root cause of the itch requires either flawless discipline during a home trial or specialized clinical testing. The management phase focuses on controlling a chronic inflammatory disease rather than achieving a permanent cure. Targeted therapies such as Apoquel and Cytopoint have changed the clinical approach to canine dermatology. These treatments act as biological barriers that neutralize the specific proteins responsible for signaling the brain to scratch. Routine topical care, including medicated shampoos and ear treatments, supplements these medications by controlling secondary infections and maintaining the skin barrier. A systematic, long-term diagnostic plan eventually breaks the chronic inflammatory cycle, finally allowing the exhausted dog to rest comfortably. While canine allergies are complex and lifelong, a methodical clinical approach can restore a dog's health and quality of life.